So when a patient gets a diagnosis of lung cancer, it's important to fully stage the disease so that the treatment can be tailored to them individually. One of the most important things is to see if the tumour has spread away from the lung to different organs such as the brain and bone. And currently patients undergo a whole host of tests to try and determine their stage. So they might undergo a CT scan followed by a PET CT, followed by more focal examinations such as MR, the liver or bone, for example. A whole body MR is a potential one-stop shop staging test. In other words, trying to replace all those triage of tests into one single scan. So the patient is scanned basically from the top of their head down to their mid-thigh in one scan, which takes about 45 minutes on most MR scanners. And then you can try and get the stage all from that one single image. Now what we did was a trial of this in England. We compared whole body MR with the standard staging pathways to see which was most effective and accurate in staging patients. And what we found is that whole body MR was just as good as the whole range of standard tests that patients undergo, but it reached the diagnosis using less tests than normal. It was quicker for patients, so about a week quicker from diagnosis to their final stage using the whole body MR pathway. And in terms of cost effectiveness, it was actually cheaper to use a first-line whole body MR than it was to do the whole battery of standard tests. So one of the important things we did as part of the trial, we wanted to make it as representative of the NHS as we could. So a lot of trials in the past have used one centre, one specialist hospital. They may use very experienced radiologists to look at the images, but of course that's fine for that hospital, but it doesn't really translate across the different hospitals in the NHS, for example. So we used 16 hospitals as part of the trial. We used about 20 radiologists. Those radiologists, although they had some experience in whole body imaging, they weren't experts as such. They were standard National Health Service radiologists. And so the results we found, I think, will be very representative of if whole body MR was indeed rolled out across the NHS, because the standard of reporting would be very similar to what we found. So I think we are potentially ready to roll out whole body MR. There are certain issues we need to address. We need to have access to the MR scanners. MRs are very heavily used machines. They do a lot of imaging of different diseases, not just in cancer staging, but knee, back, MSK type things. And so to get access to the scanners can be quite difficult. And once we sort out access, we need to make sure our radiologists are aware of the technology. There is certainly a bit of a learning curve, so they need to be trained. They need to have some mentoring when they first start off. But once they get to a certain level of experience, I think we'll be able to reproduce what we found in the Streamline trial to make it a viable option in lung cancer staging.